Dr. Michael Paul is a very famous, very well-known veterinarian, who's been around for a while, so just the right person to ask this question. When you go to the veterinary clinic with your pet, with your dog, cat, ferret, or parrot, are there questions that you should prepare for your veterinarian or a veterinary technician in case the veterinary professional doesn't ask you?
Well, I think it's very important when you go to your physician or your veterinarian to go prepared with a set of questions, a set of things that you want to make sure you have answers to. There's a reason you went in the first place, and so you want to follow those leads, if you will, to kind of steer the discussion. And so I encourage people to write down 3 or 4 key things that they want to address while they're with their veterinarian, and to tell their veterinarian, these are things I want to be sure we talk about while I'm here. Then let him or her go ahead and do what they do, but make sure that we come back to those 3 or 4 points. And there are some key things that you're going to want to know about, things that you've observed. The fact that, I've noticed he is sleeping more, or I have noticed she is maybe drinking more water than she used to.
So, okay, I want to stop you here. I mean, how important is it that as a pet owner, we pay really careful attention? I suspect the answer is the same for dogs and cats, but even more with cats, because cats aren't going to tell us. Dogs are more likely to if something isn't quite right. So how important is checking that? I've called the litter box your cat Google or something of that nature, because it tells you everything you need to know about your cat.
Tells you a lot.
If we're paying attention.
I think, the issue is that people with their own bodies tend to kind of minimize and ignore until some critical thing happens. And I'm a believer that if you don't notice anything, that means you assume it's normal. So you've got to notice. You've got to notice things like the dog's breath, their body odor, the cat's litter box, as you said, how their eating habits change. Now, they may still eat their bowl full of food in a day, but didn't they used to eat it in one setting, and now they're taking all day to eat it?
So if there's a magic word, would that be change?
Change, absolutely.
That's what you're looking for.
Absolutely. Change in behavior, change in physical attributes, change in personality, any of those kinds of things that are different than they were 6 months ago.
Now, if your veterinarian doesn't ask you about those sorts of things, for example, let's say your dog is 9 or 10 or 11 or 12, an older dog. Should the veterinarian, if that veterinarian isn't asking you about behavioral changes, and I'm thinking of sort of the dog's version of Alzheimer's at the moment,
Sure.
which is called canine cognitive dysfunction syndrome. So if the veterinarian or the technician doesn't ask you about, well, is the dog acting normal for your dog? Is the dog seem confused at all? Is the dog sleep-wake cycle different than what it typically is for your dog? These are all signs of this syndrome in dogs. Then should you bring up these sorts of things?
I'm a little bothered because I'm suffering from most of those things you just mentioned.
Not for you. No.
I think it's important for people to be asking themselves again, what's different? And the veterinarian should be asking open-ended questions rather than saying, is your dog sleeping more? To say things, have you noticed any change in your dog's sleeping habit? Have you noticed any reluctance to play? Those kinds of things. Because a lot of the changes, it's very easy to build a case for normal, and it's very easy to build a case for abnormal. And so it takes your observation as an owner to make those differentiations.
And how much responsibility is an owner? I mean, some of us say, well, if it's important, the veterinarian will ask me about it, or the technician, and oftentimes that's true. But then real life gets in the way, and veterinarians and technicians are only human beings,
right,
and may simply forget to ask a certain question. How important is it for pet owners to put some of the responsibility anyway onto our own shoulders?
I think we have to assume the key responsibility as pet owners, just like we have to assume the key responsibility for our own health care. We have to recognize the fact that veterinarians or physicians or nurses are in fact very, very busy, and they do tend to get into patterns and habits. That's human nature. And so sometimes those red flags may not get noticed. So you may have to wave it 2 or 3 times at them for them to see it. Recently, the Partnership for Pet Preventive Health Care has developed a set of guidelines to help veterinarians to make sure that every time every animal is addressed in exactly the same way, so that we ask things like behavioral questions, nutritional questions, the physical examinations, so that there are no surprises. Because if you do a systematic history and a systematic examination, we'll find 99% of the things. And I think the owners can help us a great deal. The pet owner, the pet caregiver can help us tremendously.
And after all, it is a pet owner who lives with that pet.
Day in and day out.
Your veterinarian probably doesn't live at your house. Although, maybe not a bad idea.
My wife's does.
Yeah, yes, she does. Thank you, Dr. Paul.
Thank you very much, Steve.